Hello everyone, welcome to my channel. This is a continued series, Train Up a Child, dedicated to single fathers raising children on their own. Today I would like to discuss HIV facts. This is something that we should always talk to our children about. HIV has been around for years, and now, fortunately, it can be preventable. And in order to prevent something, you have to know about it. There's no reason why any young person, old person should suffer. This is a discussion that's needed. What is your risk? You are at risk if you have had sex with a man or woman who has had other partners, have shared needles to inject drugs or for any other reason, or had sex with someone who has. You are probably not at risk if you haven't had sex or have only had sex with one partner who doesn't have HIV and who's only had sex with you. Haven't shared needles to inject drugs or for any other reason, and haven't had sex with anyone who has. The HIV test. The HIV test looks for HIV antibodies in your body. If you have antibodies, your test results will be positive. This means you have HIV. If you don't have antibodies, your test will be negative. This means one of two things. You don't have HIV, you have HIV, but your body hasn't made antibodies yet. It usually takes 2 to 8 weeks after infection for the body to make HIV antibodies. In rare cases, it can take up to 6 months. What happens in testing? A healthcare worker takes a little blood from your arm or finger, wipes the inside of your cheek or gums with a cotton swab, or asks for a urine sample. Many test centers offer a quick test. Results take 20 to 30 minutes. Positive results must be confirmed with a second test, with results in about 2 weeks. Other places send the sample to a lab. In about 2 weeks, you go back to get the results. Most test centers provide counseling to help you understand the results and learn how to prevent HIV. What test results mean? If you test positive, a confirmed positive test means you have HIV. Positive results are almost 100% accurate. If you test HIV positive, find a healthcare provider who knows about HIV right away. Early treatment can help you stay healthy longer. Services for people with HIV include help with health care, income, food, and legal services. If you test negative, a negative test means no HIV antibodies were in your body at the time of the test. This may mean you don't have HIV. A negative test might also mean you have HIV, but your body hasn't made HIV antibodies yet. Get tested again 3 to 6 months after any risky behavior. The only way to know for sure if you have HIV is to get tested. Who will know your results? Most test centers offer confidential testing. Your test results is told only to you, but is also put into your medical file. No one can see it without your signed approval. Some centers offer anonymous testing. You are the only one who sees your test result. You use a code name or number to get your result. Home testing is anonymous. HIV antibody home testing kits can be purchased at a pharmacy. You mail a blood sample for testing, along with a code name or number. Results are given by phone when you call and give your code. What is HIV? HIV is the virus that causes AIDS. People who have HIV in their bodies have HIV infection or HIV. People may not know they have it. HIV is a disease with many stages. People with HIV may have no symptoms, a few symptoms, or many serious symptoms. People can have HIV for many years without feeling or looking sick. They may not even know they have HIV, but they can still pass the virus on to others. HIV hurts the body. Over time, HIV damages the body's immune system. The immune system protects the body from disease. When the immune system gets very weak, other diseases and infections can enter the body. This stage of HIV is called AIDS. How do people get HIV? HIV lives in semen, vaginal fluids, blood, and breast milk of a person with HIV. It can be passed from one person to another through these infected fluids. HIV can be passed during vaginal, oral, or anal sex, while sharing needles and equipment to inject drugs, by needles used for tattoos and piercing, or to inject vitamins or steroids, from a mother to her baby during pregnancy, childbirth, or breastfeeding, from needle stick injuries to health workers caring for people with HIV. HIV is not passed by donating blood, hugging, kissing, or sharing food, telephones, toilet seats, towels, or eating utensils, tears, saliva, sweat, or urine, mosquitoes, or other insects. Before 1985, some people got HIV from infected blood transfusions. Now the blood supply in the United States is tested, so the chances of getting HIV this way are very, very small. Protect yourself. Use a new latex condom and a water-based lubricant every time for vaginal or anal sex. Don't use oil-based lubricants. Hand creams, massage oils, Vaseline, etc. can cause the condom to break. For oral sex on a man, use a new latex condom every time. For oral sex on a woman or oral anal sex on a man or woman, use a barrier such as a dental dam, a latex condom cut and rolled out flat, or a plastic food wrap. Use a new barrier each time. People who are allergic to latex can use plastic, polyurethane condoms. These come in both male and female styles. Don't have sex when you're drunk or high. Using alcohol or other drugs affects judgment and can lead to unsafe sex. Parents, please have this conversation with your children. Thanks for watching.